The best prescription savings programs. A hot topic I always hear about when it comes to benefits and people's health is prescription medications. As much as 66% of the United States adult population uses prescription drugs. And according to the CDC, around 46% take at least one prescription drug every month. This may include medications used to treat chronic illnesses and conditions, or perhaps, say, a one-time prescription for a short-term illness, such as an antibiotic for an infection. With so many people taking at least one medication each month, I thought it would be a great idea to talk about a few of the best ways to save on prescription medications. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. First up, let's talk about some of the prescription programs out there. Many of these programs are completely free to you as the patient. Others may offer a paid version as well. But at the end of the day, their claim is that by using their coupon, you can save significantly on your prescription medications. Now, over the last few years, I've kept an eye on dozens that are out there in the market, use them myself, and consistently check prices on various drugs. And I can tell you, they absolutely can help you save money, some better than others. As a medical cost sharing member myself, prescription medications are generally not shareable, and so fall to the member to have to pay those costs. And I can tell you that I've been able to save a great deal by using these programs. 3 that I have seen consistently deliver great savings are number 1, GoodRx, number 2, SingleCare, and number 3, the Cost Plus drug company backed by Mark Cuban. GoodRx and SingleCare are both fantastic at delivering savings on a huge variety of medications across thousands of pharmacies nationwide. The Cost Plus drug company has a more narrow focus on the scope of medications. However, they provide very transparent pricing when it comes to what their customers will pay. One last note about these prescription programs is that they will all be most effective for medications that have a generic option available. Unfortunately, when it comes to medications where there is no generic alternative, the prices can be astronomically high. And these programs can provide little, if any, benefit to bringing down these costs. Fortunately, I do have a couple ways to bring down the costs of name brand medications as well that we'll get into in just a moment. But before we get into the second half and talk about those, I want to thank Scoop Health for sponsoring this video. Scoop Health is a strong advocate for medical cost sharing memberships, which I've personally been using for several years to give me peace of mind when it comes to large medical events that might pop up in my life. I'd love to share more with you about how it's worked for me. I'll leave a link in the description, so please get in touch anytime and we can talk. Now, let's continue on with how to bring down the cost of your prescription medications when there's no generic alternative. First off, if you have a traditional health insurance plan, many drug manufacturers offer a savings card that can be used to bring down the cost of the medications. I've heard from several people lately who are taking the new drug Ozempic and thought this would be a great example. In this case, the manufacturers of Ozempic, a popular drug which lowers blood sugar in people with type 2 diabetes, have a card that allows people to pay as little as $25 per prescription. I did some research and found the retail cost to be anywhere from about $950 to almost $1,100. So these programs can be a big help if you meet the qualifications. On the other hand, if you're someone without health insurance and you're taking one of these medications with no generic alternative, here are a couple things you can possibly try. First, and I'll preface this by saying that of course this isn't medical advice, but it can't hurt to ask your healthcare provider if there are any generics out there that may give you the same result. For example, there was previously a birth control pill called Yaz, and when the patent on that drug expired, the company released a new drug called Byaz to recapitalize on a new patent and higher prices. However, if you take a closer look, the only difference between the two was that in the new Byaz, they included a dose of a common B vitamin called folate. I've also heard of cases where a manufacturer might have 2 drugs that work well in conjunction to target a particular condition, and an easy way to obtain a new patent is to combine the 2 into a 1-pill dose. If you have a doctor who's on your team, such as a direct primary care physician, they can help you look into things like this. And notice that if you simply took the generic version of the 2, then you would see the same desired result of the new brand name drug. Lastly on this topic, I also want to mention that many drug manufacturers out there offer a patient assistance program. They often have stringent requirements to be eligible, may require information to verify income or additional details. However, if your medication falls in the category of no generics available and is very expensive, then these assistance programs are certainly worth exploring. If you search for the name of the medication and assistance program, you should be able to find out more. I hope this information about saving on prescription medications was helpful. If you would like to get in touch to talk about your specific situation, I'll leave a link in the description below where you can find me. On the Health Benefits Network, we have a lot of videos pointing out many of the problems with the state of our healthcare system, and new and innovative solutions such as GoodRx, Cost Plus, and Single Care. And lastly, please leave any questions, comments, or thoughts you have about paying for prescription medications in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with your family and friends.